We're here in Cincinnati and at the Arthrofibrosis Center. And Sandy, you have quite a story.
Yes, I do.
Don't you?
Yes, it's very much so.
And I think if I can just fast forward, when you came and you had surgery and you're a year out from surgery, and you lived with arthrofibrosis for 5 years.
Yes, I did.
Because you had surgery, a total knee, in 2019.
That's right.
And then a second arthroscopic surgery in 2020. And for 5 years, your knee was about, you could bend it to about there.
Yes, at about 70 to 80 degrees.
And you told me that what was that like?
It affected my life terribly. I stopped golfing. I had trouble playing with the grandkids and keeping up with the grandkids. I couldn't swim. I couldn't kick my legs. I was miserable and very unhappy.
Very unhappy. Why 5 years?
Well, Dr. Noyes, I didn't realize that you were here. One day, my husband was out of town on a trip, and I was determined to find some kind of relief. So I went on the web, and
there we were on the web.
Well, and the way I found you was I just wrote in my problems, that I couldn't bend my leg, and I didn't even know it was called arthrofibrosis. And then once I found your website, it just opened the doors.
And just so, I didn't plant that question now, did I?
No.
So, and just to explain that, arthrofibrosis occurs with total joint surgery in only about 1% or 2% of the cases.
Mm-hmm.
And so it is true, patients don't know they have that true scar tissue formation, and that there are centers in the country that do specialize in that. And the second, you had pain at an 8 level. That's quite a bit.
Yes, it was terrible.
And probably trouble sleeping and
sleeping, walking, being able to go to a game and sit in a bleacher. I couldn't do that. I couldn't move my leg very well.
So we're going to show off now. Mm-hmm. And so you can, and of course she's the successful one, and we're going to straighten that out all the way. And you can see this is her scar. And were you open or arthroscopic?
Open.
You were open, yeah.
Mm-hmm.
And so when they're really bad and the kneecap is just solidly locked down, we have to make an incision here, but we still make a limited incision. Mm-hmm. And so it still is minimally invasive surgery. And then if the kneecap is not locked down, a lot of times we can do it through the scope, which is even more ideal. Right. And then show us how much you can bend it back all the way. Oh, that's great. Okay. So how's that feel now?
I am thrilled.
Good.
I'm thrilled.
And we got rid of the pain?
Yes. I have some days I have a little stiffness still, but I can work it out on the bike.
So that's important. That's
mm-hmm.
a very important, because mm-hmm. we never make the knee normal.
Mm-hmm.
You'll always have, unfortunately, the feeling of some stiffness, mm-hmm. occasionally some swelling that you have to work through. But it should be just much, much, much better. But not in everybody.
Minor compared to where I was.
Yeah, and now so you can resume your life.
Yes.
Again.
Yes.
Okay,
I'm
so
thankful, very thankful.
And so the final thing is you have to make quite a commitment once you have that open surgery. Do you want to explain to people what that commitment is?
Yes, I mean, I live in Columbus, and I drove down and came for PT, and they were tremendous. It was effective. They were caring. They listened to me. We worked through tough times. And then at home, I rented an ERMI, and I did that.
Yeah, you need to have these specialized machines to help you keep the flexion.
Right, and I did it like 5 times a day.
And how long did you do the program after surgery?
10 months.
Yeah.
10 months.
Yeah,
I stayed with it for 10 strong months.
Right.
Mm-hmm.
And so very importantly, at about the 5th or 6th month, you had a recurrence.
Yes.
And so we used platelet-rich plasma, PRP. So we had to go to another level.
Yes.
We had you on different medications to block the scar tissue.
Correct.
And so we did use the PRP. And that really helped you, didn't it?
It did. It was amazing. I had a lot of, I had some fluid coming back, and it changed the changed my look of my knee. It gave me relief. I was able to push through and get more range of
Really
motion.
got it. So
Yeah.
PRP is your own natural chemicals in your body. They're called cytokines, anti-inflammatory cytokines, and they're the most powerful medication we really have because it's your own cytokines working. And so we're really grateful that we've had a company donate.
Oh my gosh.
Ceiling is a company that donated that to us as a research. And so that really helped you.
Yes, it did.
Because that's a very expensive injection that you
yes,
got in our research
It was
protocol.
a wonderful gift.
It was a wonderful gift. So we'll thank
Thank
those
you.
people. Thank you. And then you needed a second one
Yes.
about 3 months later.
I needed a second one because I had a little bit of an injury. I was pushing myself a little too much. So
And that took off also.
did the trick.
It did the trick. So we used that, and again we're very happy to have that. So good luck to you.
Thank you, Doctor. Thank you, Dr.
You
Norris.
bet.
You don't know how much it meant to me.
Oh yeah. Well, thank you. You mean a lot to us too.
Yeah. And the whole staff.
And the
was
whole
incredible.
staff. We've got a great,
Incredible, yes.
yeah, Chad and
I'm
Christy.
thankful that you're like only an hour and a half away from me. So
Okay, and that's important because we have a lot of patients, and even if we really have to come and stay with us 4 to 6 weeks,
right.
and then come back. So that's the trouble with arthrofibrosis is you don't just get the surgery, and then you're all done. Like you said, it'll take 6 months, it'll take a year, but your story is so important because it's worth it to go through that.
You got to commit.
You got to commit. Okay.
Thank you.
You bet. Thank you. That's a great story.